Hello everyone, I'm Dr. Megha Chaudhary. Today we are going to discuss about maternal pelvis and fetal skull. Before we start taking notes, let's understand anatomy of maternal pelvis. So, this is maternal pelvis. It is mainly made up of four bones, two os, two innominate bone, one sacrum and one coccyx. It is made up of mainly four bones, one sacrum, one coccyx, and two innominate bone. Again, it has four joints. One is between two pubic symphysis, which is a fibrocartilaginous joint, not a synovial joint, which is a fibrocartilaginous joint. Another one is sacroiliac joint, another sacroiliac joint, and sacrococcygeal joint. So we have four bones and four joints. And in four joints, three are synovial joints and one is fibrocartilaginous joint. Again, maternal pelvis, it is further divided into two parts. One is false pelvis and this one is true pelvis. This is false pelvis, this is true pelvis. This is known as false pelvis because it does not take part at the process of the labor, because it does not form birth canal. While this true pelvis, it forms birth canal and it takes part in the process of labor. So this is true pelvis and this is false pelvis. Let's discuss about some bony landmark in this pelvis. These are the points present at the level of the pelvic inlet. This is pubic symphysis. As you can see, this is pubic symphysis. This is pubic crest, pubic tubercle, pectineal line, iliopubic eminence, iliopubic line, sacroiliac joint, ella of sacrum, and sacral promontory. So, if we pass a plane through this point, this is known as plane of pelvic inlet. This is known as plane of pelvic inlet. So, this plane of pelvic inlet, normally our pelvis is not kept like this. It is kept like this, little bit tilted. So, the plane of pelvic inlet, if we draw a line from this plane of pelvic inlet with respect to this horizontal line, it will form an angle. It is known as angle of inclination. It is known as angle of inclination, which is around 55 degrees. So, if we increase this angle like this is known as high inclination. Normally, the fetal skull engages enter through this pelvic brim like this. If we increase this angle, so there will be difficulty in the engagement of the fetal skull. So what is the obstetric significance of the high angle of inclination? First is, there will be delay in engagement or difficulty in the engagement, and it will favor the occipito-posterior position. That is, there will be difficulty in the internal rotation. So there will be increased chances of the occipito-posterior position and difficulty in labor. Why? Because of the long birth canal. So this is high angle of inclination. If we reduce this angle, so what is the obstetric significance of this thing? This is known as a low angle of inclination. There's only one obstetric significance, that is, it will favor the early engagement of the fetal skull. So let's start taking notes. First of all, maternal pelvis. It is made up of four bones. Two innominate bone, one sacrum and one coccyx. Okay, four bones, four joints. One is pubic symphysis, two sacroiliac joint, and one sacrococcygeal joint. So out of these four joints, Two are synovial joint. Synovial joint. And one is fibrocartilaginous. Fibrocartilaginous. Okay. We have discussed about some fixed point in the pelvic inlet. So, in pelvic inlet, these fixed points are pubic symphysis, pubic crest, pubic tubercle, then pectineal line, iliopubic eminence, then iliopectineal line, then sacroiliac joint, ala of sacrum, and sacrum promontory. Okay. So we have talked about angle of inclination. That is formed between plane of pelvic inlet with horizontal. That is around 55 degree. So one thing is known as high inclination and low inclination. So in the high inclination, the angle will increase. Obstetric significance is delay in engagement and favors occipito-posterior position and difficult delivery. Why? Because of long birth canal. And low angle of inclination has only one significance, that's easy engagement of the fetal skull. Okay. So let's talk about conjugates. Okay. Conjugates. There are 3 conjugates. One is true conjugate, another one is obstetric conjugate, and last one is diagonal conjugate. Okay. Diagonal conjugate is around 12 centimeter. And obstetric conjugate is 10 centimeter, while true conjugate is around 11 centimeter. So, how do you know which one is which conjugate? How to measure it? Okay. It is, first we'll talk about true conjugate. It is formed between the posterior surface of the pubic symphysis. It is formed between the posterior superior surface of the pubic symphysis to the mid of the sacral promontory. This one. It is known as true conjugate. It is also known as conjugate, anatomical conjugate and conjugate vara. It is also known as anatomical conjugate and conjugate vara, which is found between the posterior surface of the pubic symphysis to the mid of the sacral promontory, which is around 11 centimeter. And another one is obstetric conjugate, which is found between the mid of the pubic symphysis, to the midpoint of the sacral promontory. And another one is the diagonal conjugate, which is found between the posterior inferior surface of the pubic symphysis to the mid of the sacral promontory, like this. Okay, this is known as diagonal conjugate, which is around 12 centimeter. With the help of the diagonal conjugate, we can calculate true and obstetric conjugate. How do we calculate it? So for the calculation of true conjugate, we divide diagonal conjugate with 1.2 centimeter. And for the calculation of the obstetric conjugate, we divide diagonal conjugate with 1.5 to 2 centimeter. So this is how we calculate true and obstetric conjugate with the help of diagonal conjugate. Posterior superior surface of pubic symphysis to the mid of sacral promontory. While this obstetric is midpoint of the pubic symphysis to midpoint of the sacral promontory. This diagonal conjugate is posterior inferior of pubic symphysis to midpoint of the sacral promontory. Okay, it is all about conjugates. Now, let's talk about the dimension of pelvic inlet. As we have discussed about the plane of pelvic inlet, which is found between these 9 bony landmarks. If we draw a perpendicular line through this axis, it is known as axis of pelvic inlet. As we know, the pelvis is not kept like this, it is little bit tilted. So if we draw a perpendicular line from this inlet, the direction will be downward and backward. Let's talk about its anterior and posterior diameter. AP diameter, it is known as AP diameter, which is again between the pubic symphysis, superior border of the pubic symphysis to the mid of the sacral promontory, which is around 11 centimeter. The transverse diameter, it is found between the furthest point of the iliopectinean line, which is around 13 centimeter, like this. And oblique diameter, it is found between the sacroiliac joint to the iliopubic eminence. It is found between sacroiliac joint to this iliopubic eminence. How do we know whether it is right oblique diameter or left oblique diameter? If we start from the right sacroiliac joint, it is right oblique diameter. If it starts from the left sacroiliac joint, then it will be left oblique diameter, which is around 12 centimeter. Okay, so let's start writing. For the pelvic inlet, we have anterior AP diameter, which is between pubic symphysis to sacral promontory, which is around 11 centimeter. Then we'll talk about transverse diameter, which is point between furthest point in between two iliopectineal line, which is around 12 centimeter. Third is oblique diameter. Oblique diameter, which is formed from one sacroiliac joint to iliopubic eminence, which is around 12 centimeter. One diameter is also there, which is known as sacrocotyledon diameter, which is formed between same side of midpoint of the sacral promontory to the iliopubic eminence. There's one diameter also, which is known as sacrocotyledon diameter, which is formed between the midpoint of the sacral promontory to the iliopubic eminence, which is around 9.5 centimeter. It is known as sacrocotyloid diameter, midpoint of sacral promontory to same side iliopubic eminence. Okay, this is all about pelvic inlet. Let's talk about mid cavity. It is the area bounded between the pelvic inlet and the least pelvic dimension. It is circular in shape. So if it is circular in shape, so all dimension will be same. So anterior posterior dimension and transverse dimension, it will be same, which is around 12 centimeter. Okay, so mid cavity between plane of inlet and least pelvic dimension. Okay. It is shape is circular. So let's talk about plane of mid pelvic cavity. It is known as plane of greatest pelvic dimension. मिड एज वी नो मिड कैविटी तो हर चीज का मिड पार्ट आ जाएगा, तो प्यूबिक सिम्फाइसिस का भी मिडिल आएगा और सैक्रम का भी मिडिल आएगा. सो इट इज बाउंडेड प्लेन ऑफ ग्रेटेस्ट पेल्विक डायमेंशन, anteriorly middle of the pubic symphysis and posteriorly the middle of the sacrum, which is S2 or S3. So its anterior dimension will be from middle of pubic symphysis to S2, S3 vertebrae, and transverse dimension will be verse diameter. It's mainly occupy the soft tissue of the pelvis, which is like sacroiliac notch, which occupy between sacroiliac notch, which is around 12 centimeter. And again, as it is circular in shape, so transverse dimension will be 12 centimeter. Okay, this is all about mid-pelvic. Okay, so let's talk about the plane of mid-pelvic, which is between pubic symphysis and mid of the sacral bone. So its axis will be like this. The direction of this axis will be downward. And let's talk about the pelvic outlet. Pelvic outlet. It is further divided. It has two parts. One is least pelvic dimension and another one is bony outlet. Bony outlet. So as the name indicates least pelvic dimension, तो यहाँ पर जो pelvic के dimension है सबसे कम होंगे. So as it forms the outlet, तो anterior border will be formed by inferior surface of the pubic symphysis and the lateral border will be formed by this ischial spine. This ischial spine. And posteriorly, it is formed by tip of the sacrum. So as you can see, it is rhomboid shape. No? Its shape is rhomboid shape. So anterior diameter, so let's talk about its dimension. Anterior posterior dimension. Diameter is between inferior surface of pubic symphysis to tip of sacrum. Which is around 11 centimeter. Let's talk about transverse dimension. Verse diameter. It is formed between two ischial spine. Ischial spine. Which is around, according to Datta, it is 10.5 centimeter. But most of the MCQ, it is asked like 10 centimeter. So you can remember both 10 or 10.5 centimeter. So this is all about least pelvic dimension. Let's talk about bony outlet. As the name indicates, bony outlet. So it is mainly formed by like prominent bones and it is the part of our outlet. So it is mainly formed by inferior border of the pubic symphysis to tip of the coccyx. यहाँ पे sacrum नहीं आता है. Tip of the coccyx and ischial tuberosity. So transverse dimension will be intertuberous diameter and anterior posterior formed between inferior surface of the pubic symphysis to the tip of the coccyx. So anterior posterior dimension AP diameter, it is formed by lower surface of pubic symphysis, lower border of the pubic symphysis, not surface, border, to tip of coccyx, while transverse dimension was diameter is between ischial inner border of ischial tuberosity, which is around 11 centimeter and anterior posterior dimension is around 13 centimeter. So one thing we need to know about least pelvic dimension. As we know, It is formed between the inferior border of the pubic symphysis, ischial spine, and tip of the sacrum. As we call it, least pelvic dimension. तो यहाँ पर क्या क्या और चीजें होती हैं? फर्स्ट, ischial spine है, तो स्टेशन 0 होगा. So significance will be significance of least pelvic dimension. One is station 0. Station 0. यहीं पर इंटरनल रोटेशन होता है. सो इंटरनल रोटेशन will take place at this level. Pudendal nerve is present here, so we will give pudendal block at this level. Pudendal nerve block. Forward curve of the carus will start from this point. So, forward curve of carus will start. So, we can also say that if the fetal skull is at the level of the station 0, so the engagement has been occurred. Okay? Fetal skull at station 0. And one last is origin of levator ani muscle. Levator ani muscle. So this is the obstetric significance of the least pelvic dimension. Okay, let's talk about curve of carus. Curve of carus. We have discussed about the axis of pelvic inlet, which is downward and backward, while mid cavity is downward. If we draw the axis of pelvic outlet, it would be like forward and outward. If we combine all three axes, there will be a formation of curve will be there, which is known as curve of carus. So, जो बेबी है वो इसी कर्व को, इसी पाथ को फॉलो करता है. That is why it is known as curve of carus. One more thing is subpubic angle. Subpubic angle. As the name indicates, it is 85 degree. This form between two inferior rami of the pubic bone. Subpubic angle. Okay. ये जो pelvic outlet है, इसी के थ्रू बेबी का हेड आता है. Okay. If the baby's head is occupying the pelvic outlet like this, as you can see, there is little space, waist space is present, which is not taking part for the accommodation of the baby head. It is known as waist space of Morris, which is around 1 centimeter. जब भी ये pubic angle narrow होता है, ये pubic angle है, ये बेबी का स्कल है, तो यहाँ पर 1 सेंटीमीटर का स्पेस है जो कि यूज नहीं हो रहा. बट हमने क्या किया कि अब इस pubic angle को नैरो कर लिया. एज यू कैन सी, यहाँ पर ये जो वेस्ट स्पेस है वो बढ़ गया है. ओके, सो if this pubic angle decreases, there is increase of the waist space of Morris. So let's write curve of carus, which is the root fetus subpubic angle. And one more thing is subpubic waist space of walls, which should be around less than equal to 1 centimeter. So this is all about maternal pelvis. Hope you have understood this topic very well.